Welcome to Unclenched. Today we have a very, very special guest, someone who I respect and admire greatly, my wonderful mentor, Dr. Arthur Parker. Dr. Parker is now retired and living it up in Arizona. He is living his best life. He's golfing, he's bicycling, he's hanging out with buddies, and he said that he's in the best shape he's ever been in. We still definitely keep in touch, and I'm so grateful that I had such an amazing mentor on my journey with treating TMJ TMD. Before we bring him on, though, Alex, how are you? What is going
Oh,
on in your life?
I am great. And my life, even though my daughters don't live at home, it still revolves a lot about around them. And my oldest daughter that lives in New York City, she just went to Spain because she's got some ideas for some big things and meeting some people over there. And so I'm just so proud of her. And that's what's going on here. We're just being her little cheerleaders and hoping for the best for everything to come around how she wants things to. So we're proud of her.
Oh,
And
oh, I bet.
yeah, it's just fun. It's your kids are small, but when your kids get bigger and they start doing and becoming and owning their life themselves, you're just like, wow.
I can't
Like,
even imagine. Like, we're
yeah,
at such a different stage, right, with our
I
kids.
know, I know, I know.
Well,
I'm old.
no, you're not old. You're not old. But not
No.
old at all. We usually talk about a patient, right? So did you
Yeah,
have
yeah,
a
yeah.
patient? Yeah.
Yeah, so I want to tell you about a patient this past week, and her name's Lynn. And one of the reasons she stuck out to me is that she brought me the most delicious chocolate chip cookies. And a patient's feeling better when they start cooking and baking and bringing you things and everything
Ah,
like that. So they were so good. But one of the things about her is that she only had a couple teeth touching in her bite. So we made her an orthotic, and I started her in a fixed orthotic, so it didn't come on and off. And she is feeling good. Her neck pain, her
oh,
headaches, her
wonderful.
joint pain, everything is gone, and it's only been about 2 months. So she's happy as ever. We're happy as ever, and we surely appreciate those chocolate chip cookies. And all's good there. How about you, Priya? Do you have anybody exciting? And I know you're excited to get to Dr. Parker, but what's going on in your life?
So I had a patient. So one of our podcasts, we talked a lot about the SPG block,
Yeah,
I
yeah,
think. Or maybe you and I just talked about it. I can't remember. But I
yeah.
started utilizing it. So I've used it with two patients, and there was a lovely patient named Sharon who's been
Uh-huh.
in treatment for like a little over a year. Like it's been a really long time. And
Okay.
after we did two SPG injections, she started noticing a big difference in her headaches and her migraines. So now a lot of her symptoms are starting to resolve. And so that was really telling to me like how powerful that I shouldn't call it
Right.
injection, but can be, right? And so
Yeah.
so yeah, that was really exciting. I'm also going to be getting trained with Dr. Ben Sutter on the T scan, June
Yes.
14th. So that's coming up. So lots of things coming up, and I know like these get released later. So if the dates and times are off, sorry guys who are listening,
Yeah.
I can't
Right.
like yeah do futuristic stuff, but I am really excited about that, and it's been great.
Yeah. Oh, good. Good, good, good. So go ahead and bring on your man. Go ahead
Yeah.
and tell us about Dr. Parker.
Yes. So, Dr. Parker, let's bring him in. And Dr. Parker, do you want to explain like how we met, or do you want me to? Like, I was gonna get. Let's hear your version.
Yeah.
Well, my version was that my wife, my beautiful wife Debbie, was the owner of a jewelry store in Camas, Washington, where close by where Dr. Priya lives.
Oh,
And one day, Dr. Priya came into the jewelry store and struck up a conversation with my wife, and one thing led to another. And next thing I know, this young lady is calling me up on the phone and wanted to know if she could come by and shadow for a bit. So we did that for a few days, and next thing we know, we were working together, and here she is. I was like, That's how I.
Wow. That's like so great. But when you were practicing dentistry, what made you focus on TMD and TMJ? Because I'm assuming when you first got out of dental school, you were practicing general dentistry as we were all taught. But what made you kind of switch?
Well, correct. So I don't know how much time we have, but I can make a real story out of this. But
Well, good. Let's hear
We
it.
have time. We want the story.
Yeah.
That's what our viewers want.
well, so there was. I got out of dental school in 1971. Taught at the University of Oregon, as we call it in those days, in their fixed prosthetics department for about 5 years. In the meantime, just had kind of a private practice going. But long story short, I had been in dentistry ever since I was like 18 years old and trained in the military. So
Oh.
by the time I got out of dental school, I'd had a fairly long career already, long in my point of view. And I became interested in alternative forms of medicine, particularly naturopathic medicine. And I was searching out ways that could apply to dentistry. And had kind of formulated a plan. My plan was to go back to naturopathic school at that point. And but at any rate, life kind of led me back into dentistry. And one of the things that I saw from that with this new emerging TMJ field, that this was a way for me to uh, continue and develop some of the newfound skills and mindsets that I had and able to stay in dentistry. So by about 1981, 82, I guess, then I was back into dentistry, just doing a full-time TMJ, TMD practice at that point. Slowly and gradually kind of got back into doing general dentistry again. And by the late 90s, it was like the tail was wagging the dog. Yeah, because as you well can appreciate, if you're geared up to do even one restoration, you're geared up for a restorative type of practice. So went back into TMJ full time, and that's kind of where I landed after all these years. That was what was my true love, because it allowed me to kind of fulfill my mindset, which was coming from a more holistic point of view, a body-centered philosophy about how the TMJ was just part of the whole structural dynamics of the body. So,
Well, I think, that actually leads us into the next question really, really well. And so I feel like there's a little bit more knowledge these days about how TMJ can truly be a whole body thing. But there's like courses that we can take, there's information on the internet, but like back in your day, like there was no Google, right? So can you tell us a little bit like about how you figured this out and the different practitioners you worked with and trained under to learn all of this? Because I know you worked with a lot of different types of people, and a lot of us dentists aren't exposed necessarily to body workers. So I wanted to hear like who you worked with and kind of where you.
well, yeah, thank you for allowing me to kind of share some of that. Part of that was there's been so many people over the years, it's kind of hard for me to all kind of hit the highlights. But there was a time back in the late 70s, I was working in a holistic medical facility in Mexico.
Oh.
And there I got exposed to Dr. Robert Fulford. And it was one of the most mind boggling, life changing experiences of my life to see this man work with patients that had no idea who he was, what he was doing for them, and to see the universal expressions of gratitude and appreciation from each and every one of those people after they experienced what he could do was a real eye opener for me. And basically, that was whereas I was exposed to cranial therapy, cranial sacral therapy. Back in that day, the osteopaths call it cranial osteopathy.
Mhm.
So Dr. Robert Fulford was probably my first real mentor, and I determined that I was going to go to training. And Dr. Viola Fryman, who's a legendary osteopath, she would train dentists through her little approach to it. And I went to two different osteopathic medical schools and studied for, I think, 10 days with their students to learn how to do the cranial osteopathy. And that was when I came back into doing TMJ full time. So that was kind of the start of it, because I had been interested in body centered therapies. I'd been taking classes in massage and structural integration, Rolfing, and that would just kind of led me towards the cranial osteopathy and working with Dr. Fulford and his mentor, Dr. Paula Estrad, or his student. So that's kind of how I got started with it. In those days, I had to travel far and wide. There really
Yeah.
wasn't, an academy you could go to. There wasn't really any real organizations. And there was, I don't know if that publication is still available, but it was called Cranial. And it was published
Yeah.
by Dr. Riley Lunn. And it was huge because not only were there articles coming out, scientifically articles on TMJ, TMD, but it also had a schedule, a roster of upcoming classes. So that was a way for me to find other people and to reach out to them and attend their classes and
Yeah.
go that. And it was somewhere along that way. Then I encountered Dr. Barney Jenkelson in Seattle, Myotronics,
Uh-huh.
and became one of his students, which was nice and convenient. Being from Portland, I could just drive up to Seattle.
Mhm.
And that's where I got introduced to the concept of neuromuscular dentistry and all the instrumentation to do that. Back in those days, we didn't have computers, and all we had was an oscilloscope, and we took Polaroid pictures, and we just thought we were just, you know, just the advanced high tech stuff we were doing. Had big patient notebooks full of Polaroid pictures of oscilloscope scans. That's where it kind of started. So I started very early on with them, and it just really made a lot of sense. I had a lot of success with it, and I just continued on with that. So that's kind of how I got my start and really reached a more broad-based consensus. Got exposed to upper cervical chiropractic and
Mhm.
a lot of different chiropractic courses, a commonly called SOT and sacral-occipital technique.
Yeah.
So I can go on and on. I mean, just I
Yeah.
spent my whole career traveled around the country and taking classes.
That's so interesting to think back how hard it would be to get in touch with people or meet people if you didn't have the internet or these larger groups. And I mean, Junkelson, he was actually starting with all of that, like you said, with Myotronics. And you probably came across like Jay Gerber or Miyazaki and all those people.
Oh yeah, we were all in there together.
Yeah, which is just and I learned a lot myself from Jay Gerber in the orthodontics portion of it, and Rockabato with, his PT and adjusting and everything like that, but that's just so neat that you had that urge and that fascination to really hook things together from the head and neck and the jaw all the way down because it's still not taught and it's still very aggravating to me because these kids getting out of school have to find a study group or study club. And Priya told me that you had a study club of dentists. Tell us a little bit about that and how that started.
Well, back when you probably all know the term LVI in
Correct.
Las Vegas, and Bill Dickerson got started. That it really made a big splash when I first came out, and was kind of revolutionary. And Bill Dickerson, despite his uh, controversial kind of makeup, really did make some strong contributions to his vision to put together such a thing as the Las Vegas Institute of
Yeah.
Dentistry. And at any rate, a lot of people from the Portland area were going down there and taking classes and coming back. And all of a sudden, they discovered there's this old guy around who had been doing it for 25 years. And so, right in their backyard. So they approached me and we started a study group, and I mentored that group for, I don't know, 3 to 5 years, something like that. Yeah.
That's great. I'm actually next week having an ICMO study group here in Pittsburgh. And
Oh,
we've
nice.
got, I think we have 18 doctors coming from all around I have one from Toronto, one from the Philippines, Wisconsin. We got to get Priya out here, but she's got those kiddos that
Oh, I
keep
know.
her tied home. But yeah, so I'm excited about that because we've got people just coming from all over Florida,
Yeah.
Virginia, and that's how it is. And I think studying in a smaller group like that and bringing your problem cases is just so enlightening. And so a lot of aha moments, or I'll try that in my practice. So the continual learning through the study groups, I think, is just great, and I get
Yeah.
so much out of that.
Well, I'm glad to hear you're involved in ICMO. That was a big part of my growth as well, being a member of ICMO for a long time. And also, the American Academy of Craniofacial Pain was really helpful in meeting and being exposed to a lot of different people through
Mhm.
their group. And one of the things I appreciated with them was they were very inclusive and everything. And there was a group of us that were, myotronic trained and sort of um, practitioners of, and they were quite welcoming to us as well, unlike some of
Yeah.
the other organizations. And I did forget to mention Dr. Roccobato.
Yeah.
Little anecdote. I was a student in his very first class that he ever gave in the United States. So,
Wow, that's
Wow.
great.
in
That's
a
great.
hospital up in Seattle, Washington. Yeah.
Yeah, he's
Nice.
still teaching. Like
Mhm.
I need to go.
Yeah,
Yeah.
it does. I don't think he's coming to well, I don't know. Last time I talked to Jay was some years ago, but and Jay was instrumental in getting him
Yeah.
coming back to the US again.
Yeah,
But I
he
don't think
Yeah.
was
it's, I mean,
he took a little bit of time off, but he was back just this past year. And in fact, the PT that I refer to, I insisted on him taking his classes because within your dental license, you can only do so much here in Pennsylvania.
right.
And it's tough. So he went and he learned, and it took me a while to get him to go there. And he's like, I know the TMJ. I'm like, no, you don't know the TMJ. You don't know the connection until you go to Rockabato. And I had to kind of really stand on him. And when he went, he called me and he's like, Alex, this is phenomenal. But
Yeah.
like, I'm learning so much. I'm like, I know.
I know. Yeah.
It's great.
It's so great. It's so great. Well, tell me, Dr. Parker, I know this is a little off of the like outline that we talked about, but when you started treating TMJ, TMD, and you started, really looking at the whole body approach, like how was that received in this area where we live?
Not very well.
Yeah.
I was really sort of an outlier. And honestly, there were a few people that uh, said right to my face that I was this kook, this witch doctor that was doing all this crazy stuff. And Oregon was a bit more liberal than Pennsylvania in terms of
Right.
allowing what you can do. But at the same time, I was challenged by several insurance companies and the dental board about doing cranial osteopathy. And they were threatening to take my license away. And the local osteopathic community really came to my defense. They said, this man's well trained. He's working within the scope of his license. We support him. And they just
Wow.
went away and left me alone after that, which was kind of nice. The osteopathic community was really strongly in support of what I was doing and what I was about.
Well, I think, with you and I having such a high success rate, I think it's a lot because of the cranial work that you taught me, that I went to courses to learn, along with the orthotics and our like knowledge of dentistry. So I think it's so vital to what I do every single day in practice. It's huge.
It is. It's just one of those amazing things, as subtle as the work is. And, often had people say, "Can I come and watch what you do?" I said, "Well, there's really not a lot to see,
Right.
and
Right.
the movements are so small and so subtle. It's pretty remarkable that we can have such a big effect by
Yeah.
using those
Yeah.
techniques." Yeah.
Truly. Truly.
Mhm.
And a good orthotic, of course, goes right along with that. You can, if you, I don't have to tell you all, but this tripod arrangement of the temporomandibular joint, the two legs being the two temporal bones, which can be out of phase, and then occlusion, which is a huge part of it, or malocclusion, if you want to call it that. So yeah, I'd say they all have their place, and they all fit together in a really way. And I think that integrated approach allows for more success.
Totally. Totally. And I know that Dr. Alex and I do things kind of differently, in that, like, Dr. Parker, you and I did a lot of phase one treatment, and Dr. Alex does a lot of phase one and phase two treatment. So, for those listening, if you don't know the difference, phase one treatment is TMJ treatment, is stabilizing the muscles and the joints. So, it's getting you out of the pain, getting the jaw joints functioning with orthotics. Phase two is then moving the teeth with braces or full mouth reconstruction, like crowns on every single tooth, to the position found in phase one. So, Dr. Parker, was there a point that you did both phase one and phase two? And like, when or why did you shift to only doing phase one treatment, which is what I do too?
Sure. Well, yes, there was a period of time, and I had mentioned briefly that I had gone back into general dentistry for probably 10 or 15 years, and I was doing a lot of phase two during that time as well, and trained in orthodontist so that I could do a lot of the orthodontic therapy. Because if you send a TMD patient to an orthodontist, patient would come back and say they don't want to treat me. They won't guarantee that I'll be any better. Why should I do that? And so I decided to really delve into that, and I did some full mouth reconstructions on a few patients. Obviously, someone that's partially dentulous or a denture patient really makes it really easy to do something like that.
Mhm.
But so there was a period of time I did that, but also when I limited my practice, the practice really took off, because at that point in time, that the general dentist population who would be referring a patient to me didn't have to worry about me taking their patient away from them. And
Mhm.
which, when I was doing both phase one and phase two, that did happen a lot.
Mhm.
People would come in, they'd be happy with what I'd done, say, "Well, would you be my dentist?" It was a little tricky, and most of them, because they hadn't come from their primary dentist, where there really wasn't a lot of conflict in doing that. But I did note that once I started doing just phase one entirely, the practice really boomed at that point in
Mhm.
time. That's part of it. So
Yeah, I understand what you're saying, and you don't wanna step on any general dentist's toes or feel like you're taking their patients, and I think I would say the majority of my phase 2, a lot some wanna just stay in an orthotic and don't wanna move on, and that's fine with me, but they know if they ever wanna come back that they can, and we can talk about something else, but when I try to have open communication with the dentist to say they're returning to you for your routine care, because they will. And if there's one or two crowns that need to be done, I'll try to help the dentist to say, okay, I got the bite right. This is what I need you to do, or where we need the occlusion, or after they get those placed, they'll come back to me, because I really do feel like I want to help their patients, but I
Yeah.
don't want to take their patients. And that's the truth, but some aren't happy with their dentist and say, like, why for years has he ignored my jaw problems? And I'm like, well, that's a question you need to ask him. I don't know what's in his head,
Yeah.
right? But it's I think it's something that I'm want Priya to continue on, and she is. She's
Trying.
doing a lot of stuff, and I think things are great, and we have ideas to bounce off each other, even though we're across the country from each other. But it's a good
Oh,
relationship for sure,
Yeah.
and yeah.
Definitely. And Dr. Parker, I was gonna tell you too that, Kieran is getting trained in phase 2. So he's starting the LVI courses, he's starting I mean, we're just gonna look up a bunch of different courses because we wanna learn as much as we can to do the best for our patients, but I'm too busy to do phase 2, and I love phase 1. I love that part of it, but I want to be able to confidently send my patients who absolutely must have phase 2 to somebody who's very trained in it, right? So,
well, I think Karen's a
LVI
great
was a good
candidate for
starting
that,
point, and we're
number one.
gonna start
And
our
number
courses
two,
there and
if he
kind of
starts with the
grow
LVI
from there. So
courses
I'm
and
excited
maybe
to
then expands
about it.
out to other mentors, but there you have some commonality. You have a common ground to discuss a case and know where each is coming, or he'll know where you're coming from, is how you got where they are.
Yes.
Oh, absolutely.
Yeah,
Yeah, yeah.
where they are, and
Some
then it'll benefit the patient so much, right? Because it's like we're communicating so much about that person's case. Like, there's such a vested interest in it. So I
right.
think it'll be really great.
The only concern I have with the LVI now, Dr. Parker, is that they've switched all of their instrumentation from myotronics to bioresearch. So some of the scans, some of the
Yeah.
muscle testings and stuff are a little bit different. Not to say that they don't work, but Priya's going to have to help figure out, okay, how do I now switch gears back to the myotronic way? Because they don't use the myotronic tens anymore either. But, I'm sure there's a whole lot of political stuff behind the switch.
Yeah,
Isn't there
But,
always?
privy to a little bit of that story. So
yeah,
I've been good friends with Bob Jankelson for a long time. But
yeah,
so yeah, there was a fun. Well, the founder of BioResearch was a Motronics engineer to start, first engineer.
Oh,
So he just came and kind of took that concept and developed new
mhm.
technology. And some of it's good, and some of it's a little bit different.
Sure.
But you can really still get to the same place, I
Endpoint.
think.
Hmm.
Yeah.
point. Yeah.
Yeah.
Well, that's good.
So who was this Dr. Robert Fulford? You mentioned
Yes.
him earlier. Who was
Well,
he?
Robert Fulford was a legendary osteopath that practiced in Dayton, either Cincinnati or Dayton, Ohio, for most of his career. He retired down in Tucson, and what is his name? I'm drawing a blank. I don't think about these things much anymore. But there was a famous medical doctor, Andrew Weil, who wrote a number of books that were very popular 20 years or so ago. And he practiced in Tucson and got to be acquainted with Robert Fulford and went and watched him work a few times and was so impressed that he devoted a good portion of his first book to Robert Fulford and his work, I think. So that's kind of a little bit of who he was. He died some years ago, but
Mhm,
he was truly remarkable.
mhm.
I think there's some videos available even online about some of his work, and he worked a lot with children who had like recurrent ear infections, and he did a lot of osteopathic work with them that was gentle. I mean, it wasn't rough at all, and it was able to put things into proper alignment or better alignment or just kind of ease things up so that they weren't getting these recurrent infections anymore. So I feel like he was a really great body worker, like a healer. Um,
I hear. I think that's the best way to describe Robert.
That's
I
how
Wow.
feel
our patients describe you, Dr. Parker. So I still see some of our older patients and they say, Dr. Parker was a true healer. I'm like, yes, he was. He was.
Aw.
He is.
thank you for thank you.
Yes, yes.
Is there a case, like one of your most successful TMJ cases, like that sticks out to you still to this day? Is there one particular that you can remember, or two?
Well, I thought about that, and honestly, there's not a particular one, but there was a group of patients that over time I learned how to unlock, a displaced articular disc that was not reducing.
Mhm.
And some of these closed locks came in, and over a period of time, I learned how to do that pretty successfully. And I'd say it's that group. They're sort of typified by young lady, probably 16, 17 years ago, and likely was undergoing a rough home life. And she would come in fairly frequently with all locked up and the family in tears. And so it was sort of typified by that. I could get her unlocked usually sometimes within 5 or 10 minutes of that.
Wow. Did you do
So
that by manual manipulation or relaxing the muscles, or what did you do?
both, obviously, if you're going to get those muscles relaxed enough to stop compensating, then that's where the TENS comes in handy.
Mhm.
And then you can use a combination of osteopathic techniques and other things that I had developed and trained Dr. Priya in. So she's,
Mhm.
yeah.
I
Yeah.
feel like that's the secret sauce. And that's when I went to England earlier this month. I was there for almost 2 weeks, Dr. Parker, and I think we talked about this a little bit via text. There was a group of dentists, about 12 dentists that were interested in learning what we do. And so obviously I cannot teach them in 1 or 2 days what I learned from you in 3 years, right? But just to open their mind to the concept of cranial work and um, gentle manipulations and soft tissue work to really ease up the tension on the jaw and start to get it unlocked or even just start to decrease pain for patients. That the course went really, really well. And so we're going to do it much bigger, we think, next year. So thanks to you. I mean, I think you always told me you wanted me to stand on your shoulders and you know do that. And so I feel like I've done my best to do that and shout from the rooftops about what we can do for people. It's really remarkable.
Yeah. Well, good. I'm glad. I'm so proud and happy you're carrying on the tradition. I appreciate that.
Yeah,
Yeah.
definitely. We gotta spread the news, spread the word, and carry on your legacy.
Well, you're the one to do it,
Uh,
both of you. And by the way, a pleasure meeting you, Alex. You're dynamic and gorgeous and everything
aw.
pretty. So thank you.
Well, thank you. Thank you so much.
Thank you. Well, usually at the end of these podcasts, we take some questions, Dr. Parker. So, from viewers and they send in questions. So, one that stood out to me and that you really made me aware of was about hypermobility. So the question is, how does hypermobility, so Ehlers-Danlos syndrome, any hypermobility disorders, how does that affect TMJ issues? So Dr. Parker, I was going to let you answer, and then Alex and I can chime in as needed.
Well, I see. I don't know if these numbers are still accurate, but back in earlier in my career, it was fairly common knowledge that females outnumber male TMJ, TMD patients by like 11 to 1. And that was the number that we used back in the day. And and it's pretty well known that most females under the influence of estrogen tend to be more loose ligamented or hypermobile than males, generally speaking, if those numbers are still accurate. So that's one of the things, just keeping, because of that articular disc is basically held in by a group of ligaments, then that having that hypermobility can really, for want of a better term, sloppiness of the articular disc. But there's also the mandible that has a whole host of ligaments, stylomandibular ligament. Um, again, I don't think about these things much these days, so I'm getting a little bit loose with my memory, but still, we know that there's 5 or 6 sets of ligaments that stabilize and limit the TMJ. So anything that's going to influence those ligaments and call it hypermobility, if you will, then you're going to have issues around with those temporomandibular joints.
Yeah.
Yeah, I think with hypermobility, sometimes that's a little bit difficult to repeat to treat. And it's like because some really, really hypermobile patients with the Ehlers-Danlos, and depending on which rating of the Danlos syndrome they can be very difficult to treat. So I kind of, if I know they have that, I kind of tread lightly because sometimes I just don't know how stable when they're hypermobile you can really get them. And I don't know. I just think that can be just a tough one. But one thing you just said about the estrogen, and I've had this happen to a couple patients of mine that I've seen right in the beginning of their pregnancy. It might have taken them a little bit of time to get into the office. And they're like, this was hurting when I made the appointment, but it's not so bad now. And they tell me they're pregnant. And I say, well, if you're pregnant, your body's getting ready to deliver the baby. So, you're getting maybe a little bit more lubrication, your pelvis has to get ready and what have you. So I don't want to start treatment on you if you're feeling a little bit because your body is loosening up some to get ready for this baby to come. So if it's still bothering you after, if it comes back because they're getting a little bit better, then come and see me. So we don't rush in too much on pregnant people if they say, but I feel good these last couple of weeks. I'm like, well, then let's just wait a little bit and see how you are.
Yeah.
Yeah.
Yeah, and some of those patients is limiting the expectations is
Mhm.
Yeah.
important.
Yeah.
You know,
Yeah. So we have another question here too. How does TMJ cause dizziness?
well, it comes back to the cranial concept and the fact, and originally the cranial concept came about by an observation that the upper portion, the parietal portion of the temporal bones were beveled like the gills of a fish to allow for movement. And of course, there's pivot changes and bevel changes in that. But that was the first inkling that there might be something to mobility of cranial sutures in those bones. So that said, due to the thing that the temporal bones can be out of phase. In other words, using osteopathic terms, one can be internally rotated versus the opposite side can be externally. So due to the, if I can recall the term, the ocular vestibular uprighting mechanism, that the body is going to make every attempt to be able to keep the bipupillary line parallel to the horizon, right? And if that happens to be out of phase with another line through the temporal bones, then there's going to be some noxious feedback into that system. And because the vestibular apparatus are located in the temporal bones, right? That's our balance organs. Yeah.
Right.
So most people, even if they're a little bit off, can probably override that because we're primarily upright visual creatures, I think. But in many cases, people can't. That, if they perceive their three-dimensional position in space differently than maybe you or I do, then they're going to likely experience that as some sort of vertigo or dizziness.
Mm-hmm. Yeah. Well put. Priya, you have anything to chime in on about that?
No, I totally agree. I mean, that's what I see all the time is that my patients with dizziness or vertigo or that sensation of just constantly being off balance, when I check their cranial rhythm, their temporal bones are 9 times out of 10 out of sync. So if we can just get them back in sync with each other, like moving the same way, and the orthotic can help with that, the cranial therapy can help with that, then they start to feel a lot better. And so, I mean, sometimes it's related directly to the neck as well. And so we work with certain upper cervical chiropractors that can help get the neck in proper alignment, and
Sure.
that helps too. But yeah, that's my addition. What about you, Dr. Alex? What do you think?
Yeah, no, I agree with you all 100%. Sometimes, though, too, I think it has to do with the sphenoid bone. And if you can get someone in there to adjust the sphenoid bone where you have certain arteries and that coming out to your eyes and things like that, then that helps a lot too. And I have a chiropractor that only works on the sphenoid bone with me and works a lot on that when I'm going through orthodontics for the sutures and for things to expand and so yeah, that's a great thing for sure. For
It's interesting
sure.
you bring up that bone because Dr. Parker has a disarticulated skull that he passed on to me. And when I was starting to work with him, I was looking at that skull and I just looked at him and I said, "This sphenoid bone is amazing." And he said, "Yes, it
Yeah.
is." I remember we had this conversation, Dr. Parker, about that bone.
Yes.
That you're getting all geeked out on
I
us, Priya.
am. I'm getting so excited. I'm like, "Oh my gosh, I have the skull. I want to bring it out."
Well, listen, it was so nice to meet you, Dr.
Well,
Parker.
you as well.
It was
Yeah, thank you for having me. I appreciate it. Priya, I'll see your face, and I'll look forward to seeing you in a couple of weeks.
Yes, we
well,
have to get
it was
together.
so nice. I enjoyed it a lot. Priya has talked so highly about you, and I thought, yeah, I would love to meet him and see how you got your start. And we really appreciate your time out of
Yes, thank you.
retirement.
All right, thanks for having me.
Thanks for being on.
Okay. Bye-bye.